Let's talk about something that's quietly frustrating millions of people. You finish your medication, start to feel better, and suddenly the infection is back, again, and again, and again. Why does this keep happening? To answer that, we need to start with something most people were never taught. How antibiotics actually work. Antibiotics are powerful tools, but not all antibiotics are the same. There are two main types you need to understand. 1. Bactericidal antibiotics. These are killers. They destroy bacteria by attacking their cell walls or internal structures. Think of them as snipers, direct, fast, and effective. Examples: penicillin, cephalosporins, and fluoroquinolones. 2. Bacteriostatic antibiotics. These are controllers. They don't kill bacteria directly, but they stop bacteria from growing and multiplying, so your immune system can do the rest. Examples include tetracycline, erythromycin, and sulfonamides. Both types are important, but here's the problem. If not used correctly, neither will work. Many people stop taking antibiotics once they feel better, but that's a mistake. Why? Because while your symptoms are improving, some bacteria may still be alive. Stopping early gives them time to mutate, adapt, and come back even stronger. This is how antibiotic resistance is born. Now, even the strongest meds might not work the next time. Here's something else. Not every infection is bacterial. Some are viral, fungal, or parasitic, and antibiotics do nothing against those. Using antibiotics in these cases is like using a car key to unlock a padlock. It just doesn't work. Worse, it may destroy good bacteria in your body and make things worse. Recurring infections often happen when we treat the symptoms, not the root cause. Take frequent UTIs or yeast infections. You might use creams, antibiotics, or antifungals. But if your blood sugar is high or your hygiene habits are off, it keeps coming back. Other root causes: undiagnosed diabetes, hormonal changes, weak immune system, sexual practices without proper aftercare, diets high in sugar and processed food. Until the root is handled, the symptoms will return. And here's something most people miss. After treatment, you're supposed to change your underwear or wash them thoroughly with hot water and disinfectant. Why? Because some infections come with droplets, and those droplets can still carry live bacteria. If you continue wearing the same unwashed clothing, those bacteria can reinfect you, making all your treatment efforts useless. What you eat, how you sleep, your hygiene, even your stress, all of it matters. Infections love a tired, inflamed, unbalanced body. To fight back naturally, get 7 to 8 hours of good sleep. Eat whole foods, hydrate well, reduce sugar and alcohol, use protection in sexual activity, wear breathable clothes, especially for skin and yeast infections. Use probiotics to restore healthy gut bacteria. Sometimes the infection never fully went away. It just hid deep in tissues or hard-to-reach areas. Other times it evolved into a resistant strain, which means common meds won't touch it anymore. In these cases, you might need a culture test, so doctors know the exact bug and the right treatment. Miss Kimmy, 33, had repeated yeast infections for 2 years. She cleaned up her diet, started wearing cotton underwear, and added probiotics. It's been 9 months, no recurrence. Mr. Adams, 59, had chronic respiratory infections. A culture test revealed a resistant bug. He got the right meds and improved his immune health. He hasn't fallen sick in a year. This isn't magic, it's education in action. Recurring infections don't mean your body's broken. They mean you need better information and a better strategy. Finish your medications, understand the type of infection, get proper tests, and most of all, create a body environment where infections can't thrive. You're not stuck, you're healing. If this helped you, like, share, and drop a comment. Subscribe for more real health answers. This is your Health Info, your trusted voice for optimal health and wellness. Thanks for watching. See you in our next video.